We're live from our studios here in Kokomlimle on digital address GA0992539. Our lead stories this hour. Worsening statistics as community infections soar. We'll hear more from the Ghana Health Service, which is concerned about the growing number of infections. We also fight. Also coming up, we check on protocol compliance, even as organizers bemoan the dire financial consequences of the reimposed restrictions on their business. And second witness for NDC's 2020 presidential candidate tells Supreme Court hearing the election petition, the EC chairperson instructed him to leave National Coalition Center, insisting they were denied the opportunity to undertake due diligence on results submitted by some of the regions. We'll hear from him as he claims EC declaration of the results moment after they had left to consult Mr. Mahama was a deliberate attempt to deceive them. And also why did one of the judges on the panel clash with lead lawyer for the petitioner, Chachi Chikata? We have details. Do join us on DSTV 421, Go TV 144. We're streaming live on YouTube, and you can send us your WhatsApp messages as well. My name is Gifty Ando Apia. This is The Pulse. Please be my guest. You're welcome. Let me take you through the details of those stories now. One of the NDC's representatives in the Electoral Commission National Coalition Center or Strong Room, Dr. Michael Kwesa-White, says they left the room on the instructions of the chairperson of the EC, Jean Mensah, to consult with the flag bearer of the party in the last election, John Mahama. According to him, he and his other colleague, Rojo Metonunu, had difficulties accepting some of the results from the region and had insisted on verifying those results before signing the Form 13 to enable the EC go ahead and declare the outcome of the elections. Giving evidence from the witness box on the election petition, Dr. White said the EC on their blind side declared the results without their input.
You were not present at the commission because you left when you realized that the petitioner had lost the election.
My lords, that cannot be true, because as at the time we were instructed to go and have deliberations with the petitioner in that room, we had come nowhere close to knowing who had won and who had lost, because the totals as they were coming from the regions had not been put together, and of course there were issues with some of them, so we couldn't have even put the totals together and decided that candidate A or B had won the election. So there is no reason why anybody should believe that we had left because we noticed that A or B was losing the election. Besides, we did not go into that room with a fixated mindset that by all means our candidate must win. We went to the room to make sure that whatever the summary sheets that were coming from the regions were reflects the true will of the people who went out to cast their votes on the 12th of December 2020.
You see, the fixation that you have is what you have just displayed in this court. Now, let us go to your exhibit that you have attached to your witness statement. Mr. Esiedun Ketia asked me to ask you about how that letter came about.
My lords, as we began noticing challenges with the summary sheets that were coming in, we considered it proper to relay the information to one, the petitioner, and two, the political party on which he stood as the presidential candidate. And as we relayed to them, we also told them that we had sought audience with the first respondent. I should say that we sought audience twice with the first respondent. In the first instance, when my colleague went, she told him that I have heard you. You seem to have some genuine concerns. Give me a few more minutes and I will get back to you. The second instance was when she instructed that we should go and have deliberations with the petitioner and return.
But up to that point, you didn't deem it fit to register your complaint in the mode set out under CI 127.
My lords, as I had indicated earlier,
answer the question, please.
Because there was no space on the form for us to indicate the reasons.
Oh, okay. Now, did you mean this letter to be an official letter?
My lords, the question again.
Did you mean this letter to be an official letter? The exhibit attached to your witness statement, did you mean it to be an official process?
To the best of my knowledge, yes.
Now, as a lecturer, I believe that when you deliver an official process, it ought to be receipted for. Is that correct?
That is correct, my lord.
Now, look at your document and tell us where it is indicated that it was received at the headquarters or any other branch of the first respondent. Indicate for me.
My lords, there is no indication of it on the letter, but it is important to be cognizant of the circumstances of the time between the 7th and the 9th, if not earlier.
So highlights for you of what happened there. He described as deliberate deceit the decision by the first respondents, the EC, to go ahead with the declaration of the presidential results. Dr. White also took questions from the panel.
Dr. White.
Yes, my lord.
Kindly look at an exhibit, the presidential election regional results summary sheet.
My lords, please, I couldn't hear you.
Presidential election regional results summary sheet is attached to your witness statement.
Attached to my witness statement?
Yes, your witness statement.
Okay.
Eastern region.
Eastern region, yes, my lord.
The one with the... Mr. White, Dr. White, look at the one...
Yes, my lord.
Now look at the far right column.
The far
right column, the bottom part.
Okay.
Reasons if refused to sign. You see it?
Yes, my lord.
So are you seriously saying that if you had any reason to refuse to sign, you couldn't have registered it there, that column? I want you to be very... Are you seriously saying that this column could not take any reason for a refusal to sign?
My lord, with the greatest of respect, this form is designed purposely for regional representatives at the coalition center at the regional level. They are the ones who are required to sign, and a space made available for them, and state reasons. At the National Coalition Center, my lords, no space whatsoever is provided on any form whatsoever to indicate why we have a concern and we needed it registered. And in fact, it is in consideration of that we decided that let's have a conversation with the returning officer and raise our concerns.
So you agree with me that at the regional level, there's a space for parties representative to assign reasons for not signing?
Yes, my lord, but not at the national level where I was a representative.
One minute. Dr. Pesawait.
Yes, my lord.
You said you received training or before assuming your duties.
Yes, my lord.
So you've seen the Form 13 before?
Form 13?
Yes.
I have seen the Form 13 during the training process, yes.
All right. I'm going to show you a copy of the Form 13 that has been brought to this court.
Okay.
It's not in evidence yet, but I'm going to show it to you. Please show it to his lawyer and then show it to you.
Our court correspondent Joseph Akablay, who was in court today, is joining me on the line right now so we can have a conversation on the back of this. He's actually joining me on Zoom. Joseph, it's good to see you. Now, what's been the response from lawyers for both sides? We know that they usually you mount the stage and answer some of your questions. Wrap it up for us on both sides. It's always been sort of a win-win for them, as they say.
Yes, and as far as they are concerned, they always make the point that it's been a good day. And so first, Dr. Dominic Ayine spoke on behalf of the petitioner's legal team, and he insists that they had a good day. They witnessed testimony that indicates that there was an attempt to deceive them in leaving the EC strong room in order to allow for a computation that was error-ready to be carried through, and a results that were declared that indicates that there was a predetermined outcome even before the process started. They said that evidence was not rebutted and that Dr. Michael Pesawait put across a solid responses to the questions that were posed in support of the case of the petitioner.
Well, usually what the cross-examination does for whoever is doing that questioning is to run down the credibility of the witness. And as we heard Kojopo Nkrumah saying, most of the rhetorical questions that he raised, most of these will have to be answered by the judges. But we saw today that the judges themselves, had a lot of questions for Mr. Pesawait.
Yes, in fact, the judges, including Justices Yawapel, Mafusa, Professor Kote, all had questions to ask. The questions mainly related to the claim about this instruction. And that was when Justice Professor Kote even made a point that in the witness's statements to the court, he uses the word that they were asked. And so he was asking that in terms of testifying and answering the question that he was asked, he was using the word instructed. And so he said the two words are different. And so which one actually happened? And Dr. Pesawait says he was using them interchangeably, and that anytime he uses asked, he's referring to instructed, in that they were instructed. And so that was the question that came from Professor Kote, a member of the panel. Justice Yawapel's questions this time around also centered on the same issue, and it was during his interaction with Dr. Pesawait that the suggestion of harassment was put forward by Mr. Chikata, and the point that he made was to the effect that the judge was forcing an opinion, his own opinion, onto the witness in a manner that was not fair, especially related to the point that Justice Yawapel had made that if they abandoned the work that they had gone over to the EC strong room to carry out in order to go and confer with their presidential candidate because they have been instructed to do, then they did not help the cause of the petitioner in abandoning the work at that critical point in time. But Dr. Kwesa White disagreed with that, and Mr. Chikata came in to make the point that the witness was being harassed.
It's an excellent day for us in court because the issues are beginning to unfold one after the other before the eyes of all Ghanaians. Remember, this is a petitioner who came to court praying or invoking the powers of the Supreme Court that the results of the 2020 presidential election, when properly collated, come to a point where nobody got 50%. And therefore, they are asking for a rerun. And you would expect that they put witnesses in the box to advance this argument or to provide evidence that buttresses this. Today, as you've seen before your very eyes, their witnesses are here making claims of bad faith, which claims are questionable, now raising questions of the venue of the declaration, now suggesting that in one breath they say they never saw the Form 13, in another breath what is being tendered before the court they say is not a Form 13. Now today 3 key matters have been settled in our opinion. The first is this fallacy that was being initially expressed and amplified through Dr. Michael Kwesa White, that the chairperson of the Electoral Commission instructed the representatives of the petitioner to leave the strong room, and on their blind side some numbers were put together and announced. We are beginning to see clearly that fallacy at best is something that cannot stand cross-examination. You would notice that it's not just an interchange of words, instruction and asked. And I want you to take particular notice. When you read the petition, when you read the witness statement, the witness statement says, we were asked. Check the definition of asked. Now, in the witness box and under oath, he seeks to amend that and escalate the claim by saying they were instructed. And that's why you find the Venerable Akoto Ampao did not take too much time in his cross-examination. He asked one key question. He says, I put it to you that you know that you cannot be instructed by the chair of the first respondent. And you heard under oath, they could no longer tell that on truth. He said, yes, we cannot be instructed by the chair of the first respondent. And we are clear in our mind that that fallacy has been settled, and the court will take notice of it. That it cannot be true that the chair of the Electoral Commission would instruct and that the representatives of a candidate will obey that instruction. Indeed, questions as put by the council that you selected an option, you elected, and that you were derelict in your duty. That is what happened. And we are very happy that that is being settled. Another matter that is being settled is the attempt of the petitioner and his witnesses to surreptitiously question the results by discrediting their own agents. You notice that initially from the beginning of the case, they sought to make an argument that numbers had been cooked up and that the EC's computations were incorrect. Yesterday you saw the very skillful general with a calculator now arriving at 4751, 4751, 4751. Today they tried another tactic by trying to suggest that there was something wrong with the results that their agents had certified from the polling stations through the constituencies to the regions. And in cross-examination, you saw it clearly come out, and it being settled that they could not use the back door to discredit their very own agents who certified the results from the bottom up and then claim that somebody from National had said that the figures did not add up. Another matter that we believe the court will take notice of is the attempt by counsel, and we believe successfully, to settle the dereliction of duty of the persons who were nominated by the petitioner to go into the strong room and assist in the collation of results. Now, please check. The NDC and candidate Mahama accredited 4 people. 4. In the end, 2. Now, this is after they had done their parallel collation. in their collation center with the TV screens, one of which you saw Mr. Mahama pointing that they were winning or that they had won, and then their press conferences. After certifying or accrediting 4, 2 went into the strong room.
So that's Kojo Ponkruma there, who speaks for the second respondent's legal team. Let's hear from the petitioners today.
The petitioner had an extremely wonderful day today because the narrative that we brought to court, that there was a predetermined agenda on the part of the chairperson of the Electoral Commission to, by all means, whether by hook or by crook, declare Nana Addo Dankwa Akufo-Addo the President-elect of the Republic of Ghana, played out very wonderfully today, and I'm sure you were all witnesses to it. The evidence of Dr. Kwesa White made it abundantly clear that the chairperson of the Electoral Commission on that very day acted in bad faith. He made it abundantly clear that when they were asked or instructed to go and then consult with the petitioner, that is His Excellency John Dramani Mahama, on some of the observations that they had made of irregularities that were significant in terms of the credibility and integrity of the results, they left in good faith in the expectation that after consultation they were going to come back and then continue with the process as stipulated by law. However, as you all witnessed, that was not to be. Immediately they left. A few minutes after they left the strong room, the chairperson of the Electoral Commission surreptitiously and hurriedly went ahead to declare the results in their absence. Now, she basically ran all the time-honored practices and conventions that were established by her predecessors. There is a precedent that was established in 2012, where the New Patriotic Party agents raised a number of issues relating to the results that were coming in. The former chairperson of the commission, in the person of Dr. Afarijan, called a meeting of all the parties and their agents and the key stakeholders. And they sat around the table, addressed those concerns that were put before him, and then ultimately declared the results. And we were all witnesses to what happened thereafter. The current president brought a petition together with his vice president and the late Jake Obi-Chebi-Lamte to the Supreme Court, and it played out for 8 months before the Ghanaian public. So what happened on that day when she decided that she was not going to wait for them, out of respect and courtesy and in accordance with due process of law, to consult with His Excellency John Dramani Mahama before coming back for them to redress the issues, that the concerns that had been raised, shows the utmost bad faith that she exhibited. It also shows that she was determined, and this bears repeating, she was determined that by hook or by crook, His Excellency Nana Addo Dankwa Akufo-Addo would be declared the President-elect of the Republic of Ghana.
And that's Dr. Dominica Yene there. Now, Joseph, away from this earlier today, Mr. Mahama's lawyers filed a formal request demanding that the EC produces some documents to allow for inspection. Tell us a bit more about that.
And so there are 6 documents that we are talking about. The first is the originals of the constituency presidential election results collation forms. That's Form 9 for all constituencies in Ghana, so for all 275 constituencies. The second is the originals of the constituency presidential election results summary sheets, Form 10 for all constituencies in Ghana. Number 3 is the originals of the regional presidential election results collation forms, Form 11 for all regions in Ghana. Number 4 is the originals of the original presidential election results summary sheets for all regions in Ghana. Number 5, the original the declaration of the presidential results, that's Form 13. And finally, the records of the alleged updates to the purported declaration of presidential election results on 9 December 2020 of the results of 4 constituencies in the Greater Accra region. You recall that in 2012-2013, this issue came up where the petitioners then, Nana Akufo-Addo and Dr. Bawumia and Dikotanko Bechebelamtiada, asked to inspect the pink sheets. These are the pink sheets. These are the primary documents that are relied upon by the AC to undertake the declaration. And they had made a request, and Justice Adenyira, as she then was currently retired Justice of the Supreme Court, in delivering a decision on behalf of the court, and they turned down the request, and the explanation that they made then was that a need has not been established, and two, these are documents that are already in the custody of the petitioners because they have agents across the country. In terms of the arguments that are made in this particular request from Mr. Mohammed's side, they make the point that in the course of Mr. Esielu Ketia being cross-examined by the EC's lawyer, there was a reference to 2 summary sheets for Eastern region. One had a constituency, Ayenswan, included, and the other had it excluded. And so they make the argument that they need to see the originals in order to enable them know which one was used, because as it stands now, they have seen 2 sheets for one area. And so they need to have access to this particular document in order to see what the EC relied upon to declare the results. And so those will be the issues, and we can expect that tomorrow the argument will rely on that decision that the court made in 2012 and 2013 by saying that the request was not necessary because they had the document already. Then reference will be made to what has transpired in this particular proceedings to make a case for why the request is different this time around, and the court would have to take a decision as to whether to grant it or not. The Chief Justice did indicate that should they be able to deal with it in time, it will mean that adjournments will mount the witness box.
So what is going to happen tomorrow, which we have seen over the past few days, is that at the beginning of the proceedings, we'll see the time being used to handle this matter.
Yes, and so it will mean that Mr. Chikata will first put in the request. He will have to argue, cite the relevant law, and explain why this request is important. Then once he is done, the EC's lawyer responds, and he has already indicated that they are opposed to this request. Then once he is done, Mr. Kotampa, who represents President Akufo-Addo, the second respondent, will also respond. Then afterwards, as we've seen in times past, the court may now take a break and come back to give its decision. And once that is done, if it is done on time, the expectation is that the cross-examination of Jen Mensah will take place. All
right. Well, tomorrow it is there. Is it 9:30, 10?
Yes, it's 9:30. But it's also worth to note that Mr. Chikata had also indicated today that should the court grant that request, there could be the probability that you would want to call some additional witnesses to testify. And so it depends on how the decision goes tomorrow. But the time tomorrow is 9:30. Yeah.
Joseph, thank you very much. And Joseph Akable is our court correspondent there, telling us what happened today, at least giving us the highlights and what is expected to happen tomorrow. You're watching The Pulse with me, Gifty Ando Apia. I'd like to take a break now. When we return, we're talking about COVID-19. It is getting scarier. We'll talk a lot more about it. Do stay with us. You're welcome back to the show. Many thanks for staying with us. This afternoon, Ghana's COVID-19 situation is getting worse as the new variant of the virus, which are more deadly, are fast becoming the dominant strains within the community. In the latest update by the Ghana Health Service, the country recorded 772 new cases, bringing active cases to 5,515 and 8 new deaths, pushing fatalities to 424 as of January 30. This trend, according to Minister Designate for Information Kojo Oppong-Nkrumah, may get the already overstretched health facilities inundated. He therefore wants compliance to be stepped up across as government launches frantic efforts to get a grip on the virus.
Yes, because it comes with the science of it, the clinical trials will tell you exactly what you can do, how safe it is, and so I don't think it is. We should worry about that. If we trust in the better solutions, I think Yeah,
those will come right. So there's a second batch of questions. Now's a good time to take it. And while I wait for the second batch of questions, just a couple of comments. Now, because there is the very high possibility that as the UK variant becomes widespread, or a lot more widespread, it could overtake the traditional variant. And we're noticing that it has a higher rate of spread. And it appears to be associated with a higher disease burden. It means that instead of lowering our guard or thinking that, we figured this thing out, all of us actually now have to step up our guard. Because what is now around and creeping around is a bit more dire than the first one. So if your compliance level was at 5, when the manageable version was around, now that what appears to be a more dire version is around, I honestly do think they have to step up your compliance level beyond the 5 and not drop it. So we are pleased to see that the wearing of masks is gone up, but we think we are not there yet. A lot more compliance needs to be urged so that we get the results.
As Kojo Nkrumah, the Minister for Information, designates. Meanwhile, Director General of the Ghana Health Service, Dr. Patrick Abuaje, also disclosed that the majority of cases being recorded are from workplaces, emphasizing the need for companies to adapt to the shift system to help manage the situation.
The workplace is a very, very good area to harvest cases. We will be able to, we can tease out those numbers. But what we know is that if we are going to have 10, 20 workplaces reporting cases and following them up, sometimes, even as we speak now, we are still following up contacts of them. So we're not able to give you the full number of people who have come. But what we know is that a significant number of hotspots are taking place in the workplace. One workplace can give you 700 cases. Okay, compared to a household. And so anytime you start reporting workplace outbreaks becomes problematic. You have them, but I cannot put names of organizations and companies that have had outbreaks on air. But what we can show you that is a lot. And it's an ongoing process of not just counting the number of cases in that workplace, but also going to their homes and where they are to see how that outbreak has impacted on the general. So if you want to just mind and say, because of that workplace, you have 20 or then you know, because one person who got infected at work will probably go to other places. He has a gym, he has places, he has friends, and these are all that we track. And so it is a very, very important area we must look at. And that is why we are always making sure that the last October-November hike was pure.
Dr. Patrick Abuaje there. He has also been addressing concerns raised by some frontline health workers who say their incentives are yet to be paid them.
The compensation, we have defined who a frontline health worker was. The president had given a tax rebate that was up to December last year. And we had frontline workers. The frontline worker data is generated on a monthly basis based on who was on duty, who at the month was frontline worker. A lot of people have been paid. We still have some people who have a few challenges with account numbers and so on. And there's a lot of work going on to make sure that they are all paid. And so yes, we know that there are people who are not being paid. And there are specific reasons why, and they are all being assured that the payment is currently being done, so that they will be paid very soon.
Well, on the brighter side, a recent survey conducted in Accra by the Ghana Health Service has revealed a drastic improvement in the wearing of face masks. Dr. Abuaje said compliance is at 42%, up from 10% in October 2020.
When it comes to I think the protocols are very important, and we know that until the vaccines come, our face mask is a vaccine. when we had the last spike, when the face mask went up, the positives also started coming down. Currently, we just done one on the 29th, that we did assess the mandatory wearing of masks in the Greater Accra region, which is made a key center in Ghana. 6 target districts currently hotspot are Ayawaso, Koleklote, where the areas we went to. We visited 53 communities in Accra, Lorry Parks, Barstow, Busy Street intersections, overhead, and other traffic lights. This is where we have a larger number of people in public and want to see what is adherence to protocols. The data collected on the 29th of January between 7 a.m. and 10 a.m., which is where there's a peak move.
Dr. Patrick Kumar Boaje. Away from Accra, let me take you up north. There is a surge in COVID-19 cases, specifically in the northern region, that has been since January this year. According to the Northern Regional Deputy Director of Public Health, Dr. Hilarious Abiwu, the region stopped recording new cases 2 months into the end of 2020. But since the beginning of the year, the cases have been rising astronomically. Martina Bugri has that in his report.
The northern region until the last week of December was one of the regions without cases of COVID-19. But the story is different today. The Northern Regional Deputy Director of Public Health, Dr. Hilarious Abiwu, said the region has recorded 103 new cases and is suspected to rise.
Now, if you look at the numbers over the period, the last 2 months of 2020, we were virtually not recording any cases. But the last week of December till now, we've had quite a spike in the numbers. So, as we speak, January alone, January hasn't been ended, but we have recorded about 103 cases. Okay, and 79 of these are active cases, meaning that out of the 103, a number of them have recovered uneventfully and have been discharged. We have 79 now who are in the active phase, but only 3 of them are, let's say, seriously ill and are on admission at the moment. The rest of them are largely asymptomatic, without any symptoms, and so are being managed from home. And for this January, each week, the numbers we record are always higher than the previous week. We started about 2 towards the end of December, and then we jumped to about 19. Last week we had about 52 cases, and the likelihood is that this week may see even higher numbers because of the number of samples that have been sent to the lab as at yesterday.
Now, he said the ages most affected are between 20 and 45.
Right, so generally the active age group are the people who are recording the highest numbers. So for instance, you're looking at the age group 20 to about 45, okay, who are the youth and very agile. They are the ones who are giving us all these numbers. There are very few people below 15 years who are tested positive, and then the elderly group also, the numbers are quite on the low side, but the majority of them are in the active group. Now, but then again, if you look at the number that we have lost, unfortunately, there's 16 deaths we have recorded. These are largely people who have had, like they usually say, comorbid conditions, either hypertension, diabetes, or kidney problems, or things like that. Okay, but beyond the 16, we haven't had any deaths.
Dr. Abiwu said the Tamale metropolis is accounting for close to 80% of the cases, whilst a significant number is from the Sanerugu municipality.
I mean, close to 80% of the cases are from Tamale, and then a significant number also from Sanerugu, and these are very close metros or municipalities. So most of the cases are coming from here. There are very few. In all, out of the 15 districts we have, only 7 districts have recorded cases, and then close to 90% of these cases are from Tamale or Savelugu. We have one or two. So Savelugu, for instance, has just reported 2 cases. We had Saboba who also had recorded about 2 or 3 cases. We have Bushegu also recording 2 cases in this year. The last year they were not involved. So largely just a handful of districts have recorded cases.
Let's focus a bit more on vaccines. Now, head of the Center for Laboratory Services and Research, Dr. Mr. Kekari Boateng, says the FDA has more than the required capacity and ready to test the efficacy of any vaccine that the government secures for the country. Speaking with me earlier on Prime Morning, Mr. Kekari Boateng said the FDA is currently reviewing one application for the vaccine. Government intends to take delivery of vaccines in March.
The mandate of the FDA to ensure that every vaccine that is authorized for use in this country is safe, efficacious, and is of the right quality. So, no, practically that is the mandate of the FDA. Of course, the FDA is more than well equipped to do. So, and mind you, as Kwame said, there are about 6 vaccines on the market now, and the whole world needs these vaccines. So, it is not likely that you get the supply from one country. That is not possible. Most likely it will have to come from other sources. But then, as I said, as a regulator, no matter the source that is coming, no matter the type of vaccine that is, we will look at it, and if it will serve the purpose, that's to protect people from getting the SARS-CoV-2 and also eradicate this disease, of course, that's what the FDA will do, and it's more than ready to do that. And as I told you, there's one application under review now. Most of the vaccines that have EU or the emergency are normally 2 doses. I think it's only now Janssen is can be said yes, it's a single dose. But if it's 2 doses, that means it's not like you will not be allowed to take one shot of this and another. But it's likely that some people might get 2 doses from company A and other people get 2 doses from company B, because technically they are supposed to protect one against the same virus. And we were talking about the new strains. Of course, every vaccine manufacturer, and I'm sure the current vaccine manufacturer who have their markets, no, their vaccines on them, there's something called cross-reactivity. Of course, they are vaccinated people. They are going to pick blood from them, then take the plasma out. And then to see, they will like people who have seroconverted, people who have the antibody, they will check to see if these antibodies can neutralize the new strains that they are seeing. So anybody who is coming here now and filing an application, definitely trust me, the FDA works. Do you have cross-neutralization data against other strains? That's a standard question every regulatory authority works.
Mr. Kekari Boateng of the FDA there, speaking about vaccines. Well, we understand that some corporate organizations have been helping ECOWAS and indeed countries to secure some of the vaccines. And of course, we'll be talking to one of those organizations when we come back from this break. We'll also be talking about the impact of the new or the reimposed restrictions, or especially on event management. Do stay with us. We'll be right back. You're welcome back. This is still The Pulse with me, Gifty Ando Apia. Now, 2 people are currently assisting police investigations into the illegal operations of some health facilities here in Accra. One of them, controversial body sculptor Dr. Dominic Obeng Ando, is answering questions for running the Obengfo Hospital without a license from the Health Facilities Regulatory Agency, HEFRA. His facility is among 4 shut down by the HEFRA. The regulator says the move is part of efforts to sanitize Ghana's health system and ensure compliance to standards. We'll have a conversation on this. Dr. Philip Bano is registrar for HEFRA and he's joining me right now. Hello, sir. Thank you for your time. Good afternoon.
Good afternoon.
How do you assess your last operation, which ended up in shutting down for health facilities?
Okay, thanks for the invitation to be on your show. How do I assess the last operation? I think it went well. We were able to effect the arrest of 2 people. A 3rd person is supposed to turn himself in. Then another person that we have to make a special arrangement to pick up. So in effect, I think it went well.
My understanding is that you didn't really have a walk in the park when you got to the Obinfo facility. Do you want to tell us how it went over there and why?
I think there are several videos circulating on social media and some of your sister outlets. I'm trying to avoid trial by media, even because he has a defense. So I'm not trying to malign him or anything, but suffice to say that there was a spirited discussion and engagement when we were at this outfit. But at the end of the day, with the assistance of the police and all the other enforcement officers, he complied. And then he came with us, and then they began the booking process. And I know I engaged with his attorney later on in the day, and then I'll leave it as that. I'll leave it at that.
How does the HEFRA intend to ensure strict compliance to some of these actions that you're taking now? Because we know that some of these facilities end up opening up even after they have been shut. And people, I mean, my colleagues who have covered Obinfo in particular can still can attest to some of these things happening. And I'm not singling that out. This is just a general question. I was just using that as an example.
Yes, that's quite insightful. And being in the business, I think you have a historical perspective. It's not easy because when we're going after a provider, again, he has defense. There's profession standard, which is what the professional body use. That is the person qualified to do A, B, or C, or X, Y, Z. And that is what Medical and Dental Council, the professional. Now, ours is a new thing, and I'm not aware that there's been a test case. It's called the Facility Law. It's Act 829, where we do not make issues with your ability to, we don't make any references to your professional standard. However, we question whether or not you have a license to operate a facility, which invariably draws in the professional standard issue, because if you don't meet the requirement, they may not issue the clearance to operate the facility. In other words, you may have several qualified doctors in good standing, but there are few that can seek a license to operate, say, a hospital or a clinic or any other medical establishment, if I can leave it like that.
Well, I just want to find out what actually necessitated this move now. I mean, why now?
First, all of them that we went to pick up have been on our radar. And we've been giving all of them at least better than 6 months to be in compliance. So we thought that giving them sufficient time, and it's the beginning of the year, so we wanted to make sure that as part of our program of works, we follow through if there are some recalcitrant facilities that simply do not want to comply with the rules. So all of them have been at least 6 months aware that what we did on Friday could happen at any time. But for one reason or the other, they have been unable to come forward or to produce documents that would enable us to process them. So that is why we did what we did on Friday.
So since you've been at this, I mean, we've seen now HEFRA taking up this work a bit more seriously, but what is the weakest link that you have identified since you've been at this position?
Okay, thank you again. I've been here by 1.5 years now. The difficult or the most difficult challenge we have is resource. Now we have few enforcement officers, but we need more robust legal department, and then we need additional resources because there are about 8 of the regions in the country. We are yet to even establish a footprint there. So we only have offices in 8 of the regions. Nonetheless, we try to comb the entire country so that nothing out of ordinary occurs there. But that has been the greatest challenge, finding the resources, logistics, and also the HR and manpower we need to handle the over 30,000 healthcare facilities that we have in the country.
All right, Doc, I'll say a very big thanks to you, and I'm sure that we'll all be following closely to find out what happens to these 4. And just that doesn't mean that these 4, if they should do the things that are required, which wasn't there, for which reason they were closed down, that they will be reinstated, as in opened up.
Yes, each case will be differently handled based on the facts that are ascertained. And so, yes, there's that chances there. In fact, we look forward to that avenue. It will rather resolve the case than having to press or use all the resources to go to the legal system, which can be quite lengthy. But where there's resistance or someone is unable to comply, then you'll have no choice but to press further. But hopefully we can resolve all these matters.
Okay, Doc, thank you very much. I was just going to say, if you have any final words that you want to give it to us in like 30 seconds, we'll take it. But if not, those are all my questions for now.
Yes, I would like to use this opportunity to appeal to all proprietors of health facilities out there that go to our website, hefra.gov.gh, and you find the documents that you need. And if your facility is unregistered, you can begin the process now. Please do so before we have to come down hard, because it's no pleasure at all to any one of us. I don't want to see any colleague having to go through what we did on Friday. Thank you.
Thank you very much, Dr. Philip Bano. There he's the registrar for HEFRA. Well, he says, do what you have to do now before they have to come at you hard. You don't know about the reimposition of restrictions, which is something that the Ghana Medical Association has been calling for. Let's talk a bit more about how it is impacting event organizers especially. Well, President Akufo-Addo, as you know, has been urged to, as a matter of urgency, reconsider the directive on the indefinite suspension on events such as weddings, concerts and parties. In his 23rd address to the nation on measures that the government is taking to curb the spread of the novel coronavirus, he added that private burials should not exceed 25 people. But the Event Vendors Association of Ghana says its members would lose millions of cedis due to the new directive. Let's get on Zoom now and talk to the representative of the event organizers, but also an event planner himself, an MC, who will also be joining us. So Richard Abe is head of communications with the event and an event planner. Richard, good afternoon. But how exactly do they expect us to keep ourselves safe? That's a conversation I'm hoping to have with Richard, who is joining me. But
hello?
Hi.
Can you hear me?
I hear you perfectly now. That's good.
Okay.
Good afternoon, and thank you for your time.
Good afternoon, and thank you too.
Right. As I said, I'm also being joined by an MC, a very popular one as that in Takwa, MC Nana K. Hello. Well, he's well known as Elvis as well. Hello, Elvis. Okay, Elvis will join us shortly. Richard, now you say that this is impacting or will impact, at least we have an example, so this will impact your members, negatively. But then how else are we supposed to keep ourselves or the people safe if we don't do this?
Yeah, it's, greetings to all the viewers and listeners. When we say the impact, the thing is that the fact we're talking about livelihood here. We understand that there's an issue of livelihood and an issue of death and all that, and we need to look at this critically. But EVAG as an association, for instance, has been consistent on this from last year, trying to propose a lot of mechanisms to control or to ensure that there are stricter adherence to protocols. And that's how we suggested the 100 quota. If you remember the number of 100, so that we'll be able to manage them and all that. And this is something that we have done and worked well with it. So we are taught that the president, even though we understand he's a father figure and he's thinking about the nation, would have also looked at it that in a manner that we will still come back to restriction, but with a certain quota of 100, then would have been okay. So we are not necessarily against a restriction or a protocol or procedures and all that. We're just looking at the fact that a lot of our members are affected. And when I say membership, it's like even to the basic, or let me put the most of our members are more like informal. You take it from ushers, you take it from welders, you take it from painters. These are people we work with. Take it from DJs, you come up to people doing backdrops, decor, and all. It's a large number of people, and it's a chain, and they've been affected. And the fact that we've been told to refund some of the monies that they have, because there are people having weddings on Saturday, and if you look at it, from now to Saturday, caterers might have bought the things that they have to buy. So how do they refund monies to these people? A lot of people have traveled from outside to come for weddings, particularly maybe on this Saturday, families and all that now spending about maybe $1,500, $2,000 and getting tickets. They cannot do that. I mean, so we our call is that this is a very dire consequence on the larger people. And don't forget that school just reopened, and a lot of parents have paid school fees, and then they come to meet up. There's no job, and it's an indefinite thing. Whether the president is unable to define the times. I mean, luckily we'd have heard that, okay, they say marriage ceremonies and traditional weddings or traditional ones, which is on a smaller note, I mean, are allowed. But we're still thinking that, I mean, some of the people who had actually have dates for their weddings in February, in March, and all that, maybe there could be, if we have a number of 100, which we had suggested last year, which we remember that we had several meetings with Eva going to the Jubilee House and all that, which the president had considered. I mean, knowing our father as the president, maybe we'll give a considerable, or we'll give a listening ear to this one, and probably come back with, let's say, 100, and let's manage it. And when it was 100, I can tell you that, I mean, the 1 meter controls and all that, I mean, was there. But
Richard, quite frankly and seriously, we have seen events where there is absolutely no adherence to the protocols, and mind you, this never really went away. I mean, the restrictions on social gathering never really went away, but it looks like we just took it to a whole different level, which has compelled us back to where we are now, don't you think?
Yeah, no, but I would not entirely want to agree with this. You see, let's not forget that, I mean, there have been events and all that, but don't forget that, like I said, I mean, a lot of us have been in the trotro, and then at the same time, we've had people being on what do you call it, going to the market on the usual day. I mean, so this is across, but it's a holistic thing that we have to look at. And I said that people eat every week. I mean, we know food is essential as it is. And so we cannot justify and clearly say that it necessarily had to come from there. So that's why I said at the point that it may be that the events, or let me say some of these weddings and other things have somehow been misrepresented by the people who had gone to the hospitals, because I believe GMA's call was the fact that people were claiming they had gone to events, so that somebody does a small party in his own house, I mean, maybe, and probably gets it there, he extends it to think that, okay, it is from maybe a wedding and all that. And we are particular about the fact that the specification on weddings, I mean, that is where, because in our protocols that we suggested, and which we're trying to follow with some of the weddings, were that event centers were having Veronica buckets and all that. We ensured, we talked to our members also at a point. So we ensure the very protocols, the sanitizers, and all some of the events that were done, we were on shields, ushers were on shields and all that. So
let me ask you this.
I want to extend the thing to, yes.
Let me ask you this. Would you consider, how about doing a scientific work, some sort of research that you can present, because you're talking about petitioning the president, petitioning this decision because you wanted to change, at least make room for some organization of events, right? Have you considered doing some scientific work to prove that the cases we're recording aren't necessarily coming as a result of the events that have been organized? Do you think this is something you could do? Because that will convince people well enough to say that, well, let's allow programs to go on with 100 people.
Yeah, but you see, the thing is that, like I said, I mean, let's not forget that we had this 100 thing. I mean, somewhere around, I think, May or so and all that, and the way with compliance. Now, what has happened is that has a multifaceted problem. The things that in December, for instance, you see, I've always said that this is a new strain and it's becoming uncontainable, and that's something we have to deal with for some time. Yeah, and that's where it's coming. Now, don't forget that we had open borders and all that. I mean, people had also traveled from outside the UK and all that. And these countries, as I placed, I mean, UK and all that, had other borders close to them because of the new strain and all that. So it might be the benevolence of the country and the fact that we thought it wasn't a problem and all that. So these people have also come in as well. So the spread is coming from different sections. You understand? So if you are from a trotro and you go to an event, I mean, what happened that? How will you have known? Scientifically, how do we prove that it was in the trotro? I think it's a very difficult task you want to give the event vendors association of Ghana. But I just want to believe that they might have forgotten. That was people might have gone to a clinic and forgotten that they had gone to elsewhere apart from.
But Richard, you know that in the trotro, you are hardly talking. Do stay a little, be a bit stable for me. It looks like you're moving your camera a bit. I mean, you agree that in a trotro, for example, nobody is talking. But hang on, let me bring in an MC who is joining us also via Zoom from the Western region. MC Nanake, thank you very much for your time. Good afternoon. Okay, I think you're talking, but you're muted. If you would unmute, and you can hear me. So I was going to ask him, Richard, when you go for event, people are, I mean, I have seen videos where people are, there's excitement, and we're not blaming anybody.
Good afternoon, can you hear me?
Yes, I can hear you now, MC Nanake. So what is the story in the Western region? How, we know that people have booked, you know, people have booked events managers, people have booked event managers, they've booked MCs like yourself. Well, what is the story there as far as the reimposition of the restrictions are concerned? And I need you to wear your mask for me. I'm sure you are in the office.
I'm alone where I find myself. Good afternoon, Gifty.
Good afternoon. Yes, go ahead.
Well, Western region, unfortunately, we've also been hit hardly by the various new protocols that government is actually.
Hello?
So we've been booked, events been booked, and then all that, but we need to respect the authorities of the state. Just as my senior brother Richard mentioned that people have been paid, planners have been paid, same way MCs have also been paid to plan and then book various dates for various events.
So let me make it more specific. Let me make it more specific. If you compare, when we went into the lockdown, if you compare how much you used to make, for example, from MCing programs and the lockdown period, how much will you say you lost? If you can put a figure to it for us.
That's going to be a lot, because if every weekend or if every month you have 2 events, and then on the average you are charging between 2,000 and 4,000. That's on the average, 2,000, 4,000. And you have 2 events every month. So we can start from March, April, May, June, up until July, and even August. So that should tell you how much you have lost. And don't forget, you need to pay your cameraman, you need to pay your graphics guy, because you have actually recruited them on your team. And then there is nothing you can do about that one. So if we say we want to put pen and paper to it, we really went into hard times during the initial lockdown, and not expecting anything at all. This one also comes in. We're looking at quite some good amount of money, and then
that's been lost, and that's why the Event Organizers Association, the Event Vendors Association, they are saying that they want to petition, or you know, they want to petition the presidency to say we can go on with 100 at least. But the thing is, people like yourself, MCs, etc., have been blamed for going for programs like this, and you know, encouraging people to dance and shout and get together, and that's why we are seeing the spike. This is something Richard disagrees with. What do you think?
As you asked Richard, is there any scientific proof? There's no scientific proof that event hosts, MCs, hype men are quote unquote part of the spike or the figures shooting up that we are seeing. You can't really put to it. But for me, what I know is that for every event center I have been, I ask the protocol people, let's get Veronica bucket, let's get sanitizer, let's put on a face mask. Myself, if you go on my social media platforms, you realize that almost all my events that I handled from the time that we're asked to do 100 people up until now, you would see me in my face mask. And so we're actually taking
Speaking of face masks, maybe you should just take it off. Since you're alone, you should take it off completely, because what we're learning also is that the way we wear it, we wear the mask on TV. The way people see it influences the way that they wear it as well. So if you're wearing it, you're wearing it. If you're not, then let's take it off. Exactly.
I'm this looks
in
much. The office alone.
This is better. This is better. This is better. So go on with the point you are making.
Yes. So as I mentioned earlier on, you would notice that there is I have my face mask or nose mask on throughout. You see protocol people with face shield and then all that. But if you should get to the partying time, people still had their face mask on to party. So I think if my senior brother and other event vendors are thinking of petitioning the presidency, I think it's in its right direction, because all other things, we don't really have critical statements on them, because my brother mentioned Trotro. Yes, of course. How can we join Trotro full set? We get to church 1 meter. After church, we join Trotro again.
Okay.
And you see, that thing. So
but anyway,
need to take a look at our sector, and then also consider the costs that we bearing or we are actually losing. I think that would be giving us a fair share of the cake.
I'm going to wrap up now. Richard,
Yes.
To what extent can we trust event? I mean, assuming the president decides to listen to you, to what extent can we trust that event organizers will be disciplined in the way they go about their duties, so that we don't see a spike? Already what we're learning from the Ghana Health Service today is that the variant we're seeing here is a whole different ballgame. It's very deadly, and it is spreading fast in our communities.
Yes, thank you very much. Don't forget that, like I said earlier, that it's the same event Vendors Association of Ghana that last year had meetings severally, with government agencies and all that, to look at the way forward, and suggested certain kind of protocols, which actually were adhered to the extent that we said that on the dance floor, it should be only the couple dancing, that we shouldn't want to have people coming with handkerchiefs and all that. We made it clear that security too should be very tight, as it were, and make sure they follow the protocol. So the event Vendors Association has been very actively involved in the stakeholders, even with the Ghana Tourism Authority, where we had engaged them and said that we have a database of these events. I mean, we can tell you when the weddings are taking place. If you want any chair in this country, we know where you can find them. There are members. There are about 350 members, and they're spread across the country, in the northern region and all that, and then in the Volta region. So we said we could work along together. Maybe the municipals could then become an authority to enforce that these 100 that we are talking about is actually being ensured, because we can give you a database from the cake person. We can tell you a database from the rental of cannabis, that okay, this is what's happening in this particular weekend. That will be a guide, or the way to start. It could be a starting point to ensure that if we are saying that 100 people, then we'll have these authorities collaborating with EVAC to ensure the control. So we have always been there, in fact, suggesting these things. The last year, for instance, I had a meeting in Jubilee House where our president was represented. So you can trust us in terms of, I saw you showing a video, and I realized, you could see that we had a mess. I mean, this is borne by the event planner as well. And like I said, this is affecting not only MCs are within our chain, because when we get the business, we are able to call the MCs as well to come and work. It's like a whole chain that has gone down.
I see.
Do you understand? I mean, it's a whole chain. So you can trust us with the 100, because we actually did it last year. I'm sure this whole thing happened from the festive seasons, coupled with a lot of campaigns and all that. And the roadside.
Richard, I'm losing you, but I'm also running out of time. So.
That's fine.
Yeah, but I think the point is well made. I will wait to hear the outcome of your engagement with the presidency. If your petition goes through, we'll be here to talk about it. But thank you very much for your time. MC Nana K, I'll give you 30 seconds for your final words.
Well, finally, what I can say is that the authorities should consider the kind of costs that we incurring, and then see if partially they can allow for gathering and events. I think that would actually go a long way to help us. And then just as we've been doing when we allowed for the 100 people, various protocols would just be in place. So our concern is the kind of cost that we are bearing now. They actually need to take the decision on that and then come again. These events can't be blamed alone.
Well, you feel that the event management sector has been singled out because it also brings a lot of people together at the same place, enjoying and screaming and shouting and touching each other. We'll see how it goes, and I wish you all the best with that petition. MC Nana K is a very popular MC in Western region, and I spoke to the Event Vendors Association, their communication person, who is Richard Abbey. There. You're watching The Pulse with me, Gifty, and up here. Still a lot more to talk about. We have a few more minutes left before we do sports. We'll box it all in. Do stay with us. We'll be right back. You're welcome back. The General Transport, Petroleum and Chemical Workers Union of the TUC is demanding adequate protection for staff of the Driver Vehicle and Licensing Authority across the country. Their call come after a pro-NPP group, Kandahar Boys, stormed the Tamale DVLA office and allegedly ordered the workers to leave the workplace or they would burn the offices. Addressing the media today, National Secretary of the Union, Fuseni Idrisu, noted that lives of DVLA staff are at risk as similar incidents have been reported at Oda in the Eastern region. Hannah Odami was there for JoyNews.
On the 29th of January 2021, management of the Tamale DVLA office was forced to close for more than 2 hours as the Kandahar Boys allegedly demanded the removal of the regional manager, Frank Gassis. A police intervention aided the staff to get back to work. The chiefs and people of the Zope traditional area in the Volta region condemned the attacks and asked government to investigate the incident.
We therefore find it very reprehensible and misguided, the unfortunate and very unlawful attack directed at his person and other workers of the authority in the region, allegedly on grounds of their ethnicity. We therefore implore the government to, as a matter of agency, institute an investigation into the attack and bring the perpetrators to book.
National Secretary of the Union, Fuseni Idrisu, who spoke at a press briefing Tuesday, was worried similar incidents are happening in other parts of the country.
You could recall that a politically motivated incident occurred in Winneba in 2017, resulting in the transfer of the officer in charge of DVLA, Winneba. We think that as a union, we don't have to sit down and allow these things to happen. As workers, our responsibility and duty is to work. At the end of the day, we are supposed to work peacefully under no any sort of threat.
He said it is important for management of the DVLA and the sector minister to ensure staff can work in a cordial environment whilst the union continue to assist the police with investigation.
It is a concern of the national union that the workers of DVLA are at risk in the performance of their duties, and this ought to be checked by management of DVLA and the sector ministry to ensure that DVLA is safe and devoid of any unlawful harassment against the workers by any group or persons.
For JoyNews, I am Hannah Odami.
City authorities in Kumasi say the refusal of traders to relocate from the central market has stalled progress on the second phase of the Ketia redevelopment project. Chairman of the Kumasi City Market Project, Nana Ejenim Boateng, is worried funds have been released since February, funds which have been released since February 2020 will pose a problem if the work does not commence. He revealed this when the city authorities engaged stakeholders in what they call the Let the People Know campaign.
The redevelopment project of the Kumasi Central Market Phase 2 duly launched.
President Akufo-Addo in May 2019 cut short for work to commence on the second phase of the Kejetia Central Market project. Work has, however, slowed due to failure of traders to voluntarily move to satellite markets allocated by the Kumasi Metropolitan Assembly. Nana Ajeni Mboating is the liaison officer for Otumfor on the Kumasi Kejetia Central Market project.
In the phase 2, the UKEF said we should show the social impact of the people that we are moving, where we are taking them to, and be sure that what it is. Arising out of that was a €1 million budget for that purpose. KMA, in consultation with these affected traders, visited the sites of Abinchi, railways, and racecourse. We've got the places ready. To move in, they said, now you're 12 and they are still not moving. So it's like, let the people know of the cause and effect of these things happening when people are all littered around in the streets and pavements.
At a program dubbed the Let the People Know campaign, city authorities and representatives of Malaysia have been meeting with stakeholders on the state of the project. The review, €87 million have already been released since February 2020 for the project execution.
Some challenges of the day has made the project not fully occupied. Some on the side of the contractor, some on the side of the traders. The government has allowed the first phase of the money to be released since February 2020. We have still not got access to the land to start work. And just seeing that €87 million since February 2020, not even commenced. And in April, Oseche Mensah and the team and the government will have to go for second phase. What do you go to tell the donors or where you go to borrow the money that you've not even used phase 1, but you still want money?
Kumasi Mayor Osei Bientwi claims though about 40% of the area needed for the construction were released, the Christmas festivities affected the initial plan.
As at now, we've been able to give the contractor more than 40% of the space that is needed. But before the Xmas, you are all aware that a lot of arrangements were made to move some of the traders so as to give the area to the contractors. But most of the traders pleaded that that is the period that they also get their money. So we all agreed that we'll do it after the Christmas. So now we will have a meeting with the RESEC and that of the leadership of those who are working at Central Market Phase 2, so as not to destroy their business and also not to impede on the project that is going on.
Prince Apia reporting.
Prince Apia's report bringing us to a point where we have to do sports on the pulse. Do stay with us.
Thank you for staying with us on the pulse. Time now for the sport. I'm Gary Al Smith. Quickly, let's go to the Accra Sports Stadium to get an update on what's happening in the Ghana Premier League. Match day 12 game between Great Olympics and King Faisal. And Olympics are leading by 2-0, 1 goal in either half. Looks like the Wonder Club doing wonder things. Samuel Big Ashikwe got the second goal just a few minutes before we came on air to wrap that up. We'll do other things and I'll give you a score. I'm sure by the time we should be done with this segment, should be full-time by then. We just got a notification on our Twitter that the game between Olympics and King Faisal has taken a rather interesting turn. King Faisal have pulled one back. Remember, they were losing by 3-0 on Sunday and came to win by 4-3 against Brekum Chelsea. But of course, Olympics are not Brekum Chelsea. The question remains, will they be able to do the comeback for the second time in a couple of days? There are 92 minutes played so far, and so if they have to do it, they have to do it pretty soon. That's the sport for now. Thank you very much for your time. I'm Gary Al Smith. Get the full-time result on our social media handles and also on myjoyonline.com. Thank you for your time.
And this is where we call it a wrap. Of course, there's more news at myjoyonline.com. Why don't you log on and make yourself comfortable? Share the link with your friends. And this program is on demand on our YouTube channel. My name is Gifty Andopia. Do stay and have fun. Let's do this again tomorrow, God willing.